This is CBS News Miami Morning Edition.
7:43 right now. Maternal health outcomes for Black women in America are alarming. According to the CDC, Black women are 3 times more likely to die from pregnancy-related complications than white women. And while research shows most of these maternal deaths are preventable, the death rate does remain very high. So joining us this morning to discuss some of the life-threatening conditions Black mothers face and what's being done to reduce this number is Dr. Katina Kennedy. Good morning, Dr. Kennedy. Thanks for being with us.
Morning, my pleasure.
So, Doctor, we've heard many experts say systemic racism or disparities and are the main cause for the high number of Black maternal deaths. When you hear systemic racism, it's a general term to some extent. Help us understand the details of that and why you're saying it's racial here when it comes to maternal health.
Well, it's thought to say that socioeconomic status play a major role as well. However, what about people like Serena Williams or persons who, aren't poor? It's lack of equity amongst healthcare providers. Some healthcare professionals, they're just unfamiliar with diseases that affect Black women. They delay care in services when women come in and they complain of certain symptoms such as chest pain. They're ignored. They're sent home. Lack of resources, education. I've had many patients come to me after they've delivered care and they say they were scared. They felt not seen or heard by their provider. Some lack of respect and just implicit bias.
So let's get to the details of some of these different symptoms that people had and other experiences, because Black women are more likely to experiencing preeclampsia, postpartum hemorrhaging, blood clotting. These are major issues. So what can pregnant women do to lower the chances of experiencing these really life-threatening complications?
Know your health and family history is so important. And don't listen to social media trends. If you're feeling certain symptoms, don't ignore it. Speak up, such as chest pain, fast heart rate, difficulty breathing, changes in your vision, severe swelling, fever, vaginal bleeding. Go for help. Be an advocate for yourself. And do not settle for less. If you feel like there's something wrong, go get a second opinion.
Yeah, if you feel like you're being brushed off, keep going at it. Ask the questions. Ask for another doctor. So while more options for advocates are beginning to be made available, sometimes, unfortunately, you're only advocate like you're talking about. So when choosing a doctor, sometimes folks only have a certain list that they can choose from. So how do you get these questions asked and you find the right doctor for you?
Ask around people who've had experience with these providers. Also, ask for support, such as ask your insurance if you can get a doula. Certain nonprofit, they actually cover doulas. Unfortunately, some insurances don't cover it, but I know Medicaid covered doula. Midwives, the research shows that when the reimbursement decreased for midwives and they decrease midwife use in delivery of care, the mortality increased. The research shows that midwives really enhance the delivery of care.
Yeah, we talked about doulas last week and the importance of them. Dr. Kennedy, thanks so much for joining us today. We appreciate your time.
You're welcome. My pleasure.
Absolutely.